table and have each member of the board and staff member. Dr. Romero. I'd like to go over first the process that we've been following for the licensure of the facilities. This is a little bit longer than you've seen in the past because there's been a couple of steps that have been added post-licensure. The process is that we get an initial application from the facility. They give us a letter of readiness telling us when they're ready for their initial licensure inspection. The initial license survey is conducted. It is an announced survey. If in the normal course of events there were no deficiencies, we would jump directly to the recommendation and issuance of a license. In this case, all the facilities had some deficiencies, which is not unusual for most facilities on initial licensure. So a plan of correction was requested from each facility. They were submitted by the facilities. The plan of correction was accepted, and licenses were issued to all 20 of the key applying facilities. Normally, we would then go directly to the application renewal process. But for some facilities, we initiated some unannounced revisits. For 10 facilities, we did an unannounced survey revisit. And this is consistent with what we would do with pretty much any of the licensed entities that we take care of in the office. If deficiencies are found on an unannounced survey revisit, a plan of correction is typically requested and received from the facility. The plan of correction has been accepted. Everything is good. For a select number of facilities, we can do a second unannounced licensure revisit, which we did in this case for 3 facilities. We completed those unannounced second revisits. At this point, if the facility was deficiency-free, no further action would be taken until license renewal. If additional deficiencies were found, or if repeat deficiencies were found, we would then evaluate that and make a recommendation for the next step. Renewal applications all expire the end of this month annually, and we have received some renewals. I think we have a slide on progress. All 20 initial licenses were issued. Reminder letters 19 of the 20 facilities, and a letter stating that they will not be applying for renewal has been received from one facility. No additional complaints have been received regarding abortion facilities since the last board meeting, so those numbers have gone unchanged. The revisits that we talked about, or I mentioned already, the second revisits that we've done, the 3, those have been just completed recently, and those reports are still being evaluated by my staff and myself. So we have not yet reached the point where we can make a recommendation on what to do regarding those 3 revisits. And finally, the 2013 session of the Virginia General Assembly, there were a number of bills that were introduced that had to do with abortion facilities and the licensure of abortion facilities. 3 of the bills introduced would have repealed the requirement for licensure, and 2 of them would have exempted existing facilities from licensure. All 5 of those bills were either left in committee or passed by indefinitely. An additional 6 bills addressing the use of ultrasound for funding for certain abortions and the use of abortion for sex selection or birth control were also left in committee or passed by indefinitely. And finally, a bill that dealt with FOIA exemptions, Freedom of Information Act exemptions, was introduced that would give discretion in a withholding from FOIA plans that dealt with emergency processes for a healthcare facility in response to terrorism and other emergency plans, and that bill did pass.
Any questions of Eric? Jim?
I have a number of questions regarding the results, preliminary results of inspections, the revisits in particular that you made. Is there any evidence that the condition of any of the inspected facilities puts women's health at risk?
The revisits, the first revisit, and again, the second revisits are still under review, so I haven't finished reading those yet. The first revisit showed a number of facilities had not corrected any of the deficiencies or had not corrected all of the deficiencies from the first announced visit. And that included issues with regard to infection control, medication storage and administration, as well as some procedural issues and governance issues. And we're not counting in those deficiencies the building issues, because there is a grace period on that, so those are not included in what we're citing on follow-up visits.
Is it normal for in the inspections of not just these clinics, but any other facilities that you inspect, for there to be long delays between the time you observe a problem and the problem being corrected?
Mr. Chairman, no. Typically, the corrections are made. I mean, the plan of correction requires for them to give us a date in which the deficiency was corrected. Not when they're going to correct it, but when it was corrected. So when we accept the plan of correction, it is already corrected according to the report.
Then I'm confused about why you would say that on the revisits, some of the things you had cited for them hadn't yet been fixed. What's, I don't understand. I would have thought that if they were required to submit a plan of correction, they would have done it and made the correction in short order. Not true?
That was our expectation as well.
Eric, give us one example, just one example of what the violation was.
Again, we went back in and found expired meds.
Expired medicine?
Medications, yes, sir. And I don't recall which facility, sir.
So the basic stuff.
Yes, sir.
Was a case like that or other similar justification, should it have been justification for requiring closure when you re-inspected and found that the situation hadn't been resolved?
Our normal process, not only for Mr. Chairman, our normal process is for any facility that we license. If we conduct a revisit and we find additional deficiencies, we again ask for a plan of correction. We give another chance to fix those issues.
I gotta say that I'm surprised or just don't understand that if a facility hasn't complied with their agreement to remedy a problem that you've identified, why there isn't something that amounts to more immediate action to get them to fix it.
Mr. Chairman, again, following our normal process, and we're making sure that we do this as we do with outpatient surgical hospitals, that we do with hospitals, that we do with any of the facilities that we license. There is an opportunity, facilities are given every opportunity to fix the deficiencies that are found on survey. And that includes an opportunity to produce a plan of correction after a revisit.
You know, the philosophy, I've been in EMS for a very long